More than 20 years ago, a group of urologists had a vision: the need for a specialized hospital focusing on urology. The Urology Hospital is the fulfillment of that vision and has proudly celebrated 20 years of service excellence on 16 September 2016. The hospital is privately owned by the doctors practicing at this unique facility, which forms part of the Urolocare Group. As a center of excellence with advanced technology, it is still the only dedicated urology hospital in Africa.
Well, I've been here since 2000, 16 years. And it's always been a privilege to work here because it's a center of excellence.
I think what makes this hospital unique is the fact that in one hospital you have all the technology and facilities available to cover every aspect of urology. That was one of the original ideas, to be able to do that, because before this various hospitals had various facilities and various technologies available, so that you had to move between hospitals and move patients between hospitals. So that's one of the things that makes it unique.
The fact that one can have a one-stop facility where nothing lacks. We do not need any other input from other units because the expertise is here and the equipment is here.
What makes the Urology Hospital unique is the more than 20 urologists under one roof, providing the ability to treat any male, female and pediatric urological condition. Some of these conditions are bladder problems, kidney disease, kidney failure, urological cancer, male infertility and prostate disease. At the forefront of technology, the hospital was the first to acquire the Da Vinci robotic system in South Africa. To date, nearly 800 robotic prostatectomies have been performed at the hospital.
We try to be in the forefront of new development, and I think the robotic surgery is the best example of that we've been the first hospital in Africa to acquire a robot, and it's one of the main ways that we treat prostatic cancer now in this hospital. And I think to be the trendsetter in private healthcare is what really excites me about this hospital.
This, for instance, is a development that brings minimally invasive surgery to more patients, because more surgeons will be doing these procedures with this machine.
To date, we've done by far the majority of the cases, robotic cases at this hospital. And I think it's a huge advantage because it offers more patients the access to minimally invasive surgery, and more doctors would then also, as time goes by, acquire the skills to be able to operate minimally invasively on a patient without having to make huge cuts and with the associated morbidity with open surgery. We try and circumvent that, and that's a big advantage to the patients.
The facility has 125 beds, with 7 operating theatres, an ICU, 3 surgical wards, and a day ward. In addition to the 22 urologist surgeons, a general surgeon and a surgeon intensivist make up the surgical team. The medical team is made up of physicians specializing in nephrology. A gynecologist is part of the pelvic wellness unit, which is the only one of its kind focusing mainly on female urological disorders. The pelvic wellness unit was started by Dr. Frans van Wyk, a pioneer in female urology and co-founder of the Urology Hospital.
I started the pelvic floor wellness clinic about 2 years back, where myself and Dr. Raymond Campbell, as well as a gynecologist, Dr. Paul Swart, and the surgeon, Dr. Norbert Velkovic, are working together. And we are doing a holistic pelvic floor unit. So that's a new venture. I've always been interested in that more reconstructive part of urology.
Additional services include a dedicated urodynamic unit, radiology, pathology, nuclear medicine, and a dialysis unit. The the hospital pharmacy was the first to acquire a robotic dispensing system, keeping at the forefront of technology. The advantages of a specialized hospital are far-reaching in that the staff are specifically trained in and focused on neurology. The patient admin and support staff facilitate a smooth admissions process, making it convenient for the patients.
I think the support staff in this hospital is of a very high standard, and we hear that from patients, especially from the nursing side of things. A very high standard of nursing is practiced here. Very good management in that respect, and the other management of the hospital is of an excellent nature, and we're just going from strength to strength.
The nursing is a more urologically qualified nursing. They have more experience of all the possible problems and how to avoid those problems, because once again they do that all day for many years long, so they become better and more knowledgeable how to handle, how to warn early, what to do in time and not waiting until it's too late.
It's about the training that they receive on that, and even in the hospital, in the theatre, we put some of the nurses to scrap for urology specific courses, and there we've registered a urology short course in the Urology Hospital as well, and then the staff, so that they really know exactly what to do with the patient urology related.
I think one of the amazing things is we do a patient survey on a daily basis, and it's quite amazing to see the results of these surveys, and we are hitting in the 96th percentile for every single item in terms of service that we give to our patients.
Urologists at the hospital are also affiliated with the academic world, ensuring continued research and the latest developments in urology.
I think what sets us apart is the fact that we are a number of urologists working here. We have a natural peer review, so we practice urology at the best possible level that we can. And the biggest advantage, once again, is to the patient in the realization that that would be what would happen here.
It's the only peer review system we have in private medicine. We work together for the greater good of urology, but still we work as separate entities. Your work must always be top class, because your neighbor is a urologist and competition. You both work towards the same ends. We drive technology, we drive new developments. We do quite a significant amount of research in the hospital. And I think for urology as a whole in the country, and specifically then for our patients, we do well.
Our patients are comforted in the knowledge that such a facility exists, where specialized medical care is given with passion by dedicated staff.
I think the biggest thing we got out of it is a fantastic environment to work in. I've often said that if I look around me, I see happy faces.
The hospital recently launched a caring campaign celebrating 20 years of caring.
It makes me feel good to be able to go home after a day where I know I've done things that made other people's lives better.
I think we really care for our patients, that we really go out to walk the extra mile for the patients, for the doctors, and even for our colleagues working with us. And I think that is what is making us one of the hospitals to work for and the companies to work for, and for patients to come to.
The Urology Hospital, a center of excellence pioneering urology in South Africa.